He's having some low back pain. He's been coming in, so we're just going to do an adjustment video on him. His hips are out a little bit, almost 1.5 inches, close to 2-inch leg differential. We see this a lot. Okay, got Zach in the office. He's a teacher. He's basically a mechanic on the side, works on his own Zoom. What do you build now?
A couple Mustangs, actually.
Building a couple Mustangs now. So tight spaces, underneath cars, all that, the whole deal with that. Plus, as a teacher, a lot obviously stress with school this year. So we highly recommend teachers come in. You see, we have a ton of teachers to come in the office. So he's having some low back pain. He's been coming in, so we're just going to do an adjustment video on him. His hips are out a little bit. You can see the difference in his leg length. He's got a good almost 1.5 inches, close to 2-inch leg differential. We see this a lot. His right leg is not shorter than his left. It's the same length, but his hips are so rotated and out of place that it's causing this differential here, and that's putting more strain on his low back. So it's easy to fix. You just do a couple of drops. We love the drop table here because it is comfortable for the patient. He can lay flat, neutral posture, doesn't have to move, but we're still getting a good effective adjustment on him. And we'll do some soft tissue, but let's do some here. Good. I'm always kind of getting into this sort of where his QL comes down to his ilium. And we kind of get right on that insertion point and hold a little pressure just to help relieve some of those back spasms. You okay? Mm-hmm. Take a deep breath. Just relax your shoulders all the way out for me. Good. Tight there his back. That's good. We could even do this drop work in the mid back, and we do quite often. So. That adjustment's good for mid-back pain, between the shoulder blades. Can't say it enough. If you're having back pain, don't just ignore it or take medication for it. It's something that by getting realigned, by getting adjusted, you can get to the root cause of the problem. You can prevent it from becoming a bigger problem down the road. Don't just mask that pain, because scar tissue is going to build up. You're going to be left a lot worse off if you just mask symptoms. Come in, get adjusted, let us check your spine, take an x-ray if we need it, and get to the root cause of your problem, which for mechanical back pain is almost 100% is misaligned spinal joints or restricted spinal joints. Okay? Traction too, and then we'll get them adjusted. Yeah, actually back. So since his right side, it's your right side? Mm-hmm. Or is it both for you?
Usually my right, actually.
Yeah, so his right side is what's bothering him. That's where his hips are up. So we just kind of take it and get a little extra stretch on this SI joint by using flexion distraction. Good. Excellent. Side facing exactly. Take a nice deep breath in. Straighten that bottom leg out. Blow down, exhale. Good. Face up. Other side. I'm sorry, other side. Deep breath. Exhale. Nice and easy. Face up. Mid back this way. Slide down. Cross his arms. Big hug. Exhale. Blow down. Get out of the way. Good. Good. So far, so good for you. So far. Just relax your shoulder. And this side, just relax your shoulders again. Think about it. Perfect. Hang on, both sides. Full wing shift. Good. Let your leg drop down into my hand. Good. Perfect. Let that leg relax. Let that hip drop. Awesome. to put you on camera every time. You got a good adjustment today. Thank you. What was that roller bed? You know what I'm talking about. Roller bed.
I like the roller bed.
That's it. Thank you. You just pain in your hands again?
Yeah, kind of like last time where must
Lean
have
back a
something
little bit.
like dislocated or something because I'm having pain.
Did it help?
Yeah, last time it went away instantly.
Just lean back away a little bit here. Perfect. Nice. Drop again. Is it both hands?
Mostly this one.